Live from News 4 New York, this is a special report.
Good morning to you. I'm Jen Maxfield. We're breaking into programming because New York Governor Andrew Cuomo is holding a news conference on coronavirus in Albany. We are going to listen in, but of course to update you on what is happening. As of last night, New York has shut down 100% of what the governor deemed non-essential businesses, urging everyone to stay home, to stop the spread, to help flatten the curve of coronavirus, and also to review the governor and Mayor de Blasio asking for federal assistance here. Mayor de Blasio warning this morning that the city's 11 public hospitals are in danger of running out of personal protective equipment, the essential masks and other equipment that doctors, nurses, and other healthcare providers need. There's a concern that they could run out of those by the end of the week. So asking for support from the federal government and the military as well to make sure that healthcare providers are safe. Also wanted to update you that the mayor and governor are asking the federal government to also help with constructing new healthcare facilities because of concern about meeting capacity at the hospitals in New York City based on the flood of cases that have been coming in late last week, over the weekend, and certainly continuing today. There is discussion about putting together 4 FEMA hospitals. Each of them would have 250 beds, and that would be coordinated by the federal government to help support healthcare providers in the tri-state. Now, of course, people are wondering about testing. Testing, a big issue for anyone showing symptoms of coronavirus right now. We've talked about how difficult it's been. We're going to tell you more about those drive-through centers. But first, we do want to join Governor Cuomo.
Who everybody knows. She worked for President Obama. She was Chief of Staff to the Attorney General. She's been working with me for 7 years. She's current Secretary to the Governor, Larry Schwartz, former Deputy County Executive Suffolk, former Deputy County Executive Westchester, former Secretary to the Governor Patterson, then former Secretary to the Governor under Governor Cuomo, 2011 to 2015. And Bill Mulrow, a financial expert, Secretary to the Governor 2015 to 2017. The reason I wanted you to meet these people, in some ways it's like putting the band back together, but it's also the most competent group of government professionals that you could put together to address this difficult time. I've worked with these people for 30 years. We've gone through all sorts of different situations together. We did Superstorm Sandy together, the Ebola virus together. We've had problems with the federal government. We built airports, roads, bridges. So they're just the best team that you could have working on behalf of the state of New York. And I thank them all very much for their help and their assistance and their volunteerism, because most of them are not getting paid. You're getting $1. The increase in the number of cases continues, and that is what we're watching every day. They see it as an upward trajectory. I see it as a wave that will break at one point, and the question is, what is the point of the break? And when the wave breaks, does it crash over the healthcare system, right? That's what we've been talking about. So 2 tracks simultaneously. You have to reduce the spread of the rate of the virus, the rate of spread of the virus. You're not really going to control the spread, but you can reduce the rate of the spread so you can handle it in your hospital system. That's what every state is doing. That's what this is all about. How do you reduce the rate of spread? Reduce the density, do more testing, isolate the people who test positive. Second track, increase hospital capacity as quickly as you can, so that at the apex of the wave, you have the hospital capacity for the people who will need the hospital capacity, which are the vulnerable people that we have been talking about. Reducing the spread, density control. We've taken every action that government can take. Closed gyms, theaters, other high-density businesses, non-essential employees, social distancing. Matilda's Law, remember, this is about protecting vulnerable people, older people, senior citizens, compromised immune, underlying illness. Those are the people who are vulnerable here. That's the focus of all of this. The greatest density control issue right now is in New York City. I saw the issue myself. I told New York City I want to plan. Yesterday I said I want to plan on how they're going to control and reduce the density. I want the plan today. I want the state to be able to approve the plan. It has to focus on young people and the gathering of young people. I've said it before. You can get it. The numbers show you can get it if you're a young person, and you can transmit it. It's reckless, and it's violative of your civic spirit and duty as a citizen, as far as I'm concerned. If New York City needs legislation to enact their plan once we approve it, I would ask New York City to pass that legislation quickly. If they have a problem passing legislation, they should let me know. Also, on reducing the spread, increase the testing capacity. When you identify somebody positive, isolate that person. What we've done on testing is important. March 13th is when the state got the authority to start testing, right? Up until then, the federal government was controlling all the testing, and it was going through that bottleneck of a federal government. I don't mean that in a pejorative way, but it had to go through the FDA, the CDC. I said decentralize that task, let the states do it. March 13th, the FDA allowed the state to start testing. In 10 days, we have gone from testing 1,000 people per day to 16,000 people per day. Well, how much is that? That's more than any other state in the United States is testing. That's more per capita than South Korea, which was the gold standard of testing. They were doing 20,000 per day on a much larger population, about double the population of New York. So we're doing 16,000, which compared to China, South Korea per capita is even higher. So in short, we're doing more testing than anyone. 2 points off that. Kudos to the team that put that testing in place, and the nurses and the doctors. God bless them for being out there every day and doing it. But also, our numbers will be higher on positives because we're doing more tests. We have multiple locations working now, and we'll be increasing those locations. Second track, increase hospital capacity, increase the number of beds. We have 53,000. We may need 110. We have 3,000 ICU beds. We may need between 18 to 37,000. That's my greatest concern, because that's where we need ventilators to turn those ICU beds into beds for people suffering from the virus. We are today issuing an emergency order that says to all hospitals, you must increase your capacity by 50%. You must. Mandatory directive from the state. Find more beds, use more rooms. You must increase your capacity 50%. We would ask you to try to increase your capacity 100%, okay? So we now have 53,000 beds. We need 110,000 beds. If they increased the capacity 100%, that solves the mathematical projection, right? I think it's unreasonable to say to every hospital, basically double your capacity. I don't think it's unreasonable to say try to reach 100% increase, but you must reach a 50% increase. 50% increase, we're only at 75,000 beds. We still have a problem between 75,000 and 110. Once you secure the bed, you have to secure the staff. You are going to have staff that are getting sick and need to be replaced. You create these new beds. You don't have the staff for those new beds now. They just don't exist. Your staffing is to your number of beds. You increase the number of beds, you need more staff. We are going to the entire retired community, healthcare professionals, and who are licensed, registered, and we're saying we want you to enlist to help. It's not a mandatory directive. I can't legally Well, I probably could legally ask them to come into state service, but this is just a request. We've put it out. We've gotten very good response. There are hundreds of thousands of healthcare professionals who are licensed or registered in this state, but we have 30,000 responses to date, and I'm doing an emergency order, executive order for all nurses who are registered to enlist. And the Department of Financial Services is sending a directive to insurance companies. Health insurance companies employ many nurses, doctors, etc., in the insurance business. We're saying to the insurance companies, we don't need them in the insurance business now. We would like them to help in hospitals, because this is not about assessing insurance claims at this point. This is about saving lives. When we get to assessing insurance claims, we can handle it then. Supplies are the ongoing challenge nationwide. Masks, PPE, ventilators are the #1 precious commodity. This is happening on an ad hoc basis. We are competing with other states, as I have said. We have made certain strides. We have a full team working on it. We're very aggressive. We're talking to other countries around the world. We're talking to companies. We have New York manufacturers who are really stepping up to the plate and converting factories, etc. But this is not the way to do it. This is ad hoc. I'm competing with other states. I'm bidding up other states on the prices. Because you have manufacturers who sit there and California offers them $4. And they say, well, California offered $4. I offer $5. Another state calls in and offers $6. It's not the way to do it. I was speaking to Governor J.B. Pritzker yesterday about this. Why are we competing? Let the federal government put in place the Federal Defense Production Act. It does not nationalize any industry. All it does is say to a factory, you must produce this quantity. That's all it does. I understand the voluntary public-private sector partnership, and there are a lot of good companies who are coming forward and saying, let us help. But it can't just be, hey, who wants to help, let me know. We need to know what the numbers of what we need produced and who is going to produce that and when. I get that a lot of companies are stepping up and doing good things, and that's a beautiful thing. They're doing it here in New York, too. But you can't run this operation that way. It can't just be based on we're waiting for people to come forward with offers.